Most cases of breast cancer occur sporadically or by chance. Sometimes breast cancer may be caused by an inherited genetic mutation that has increased the chance that breast cancer will develop. Today, we're going to talk about genetic counseling and genetic testing as it relates to breast cancer. There are several very important facts to be aware of. Most women diagnosed with breast cancer do not have a family history of the disease. Most women who have a family history of breast cancer do not develop breast cancers themselves. Only about 5 to 10% of breast cancers are caused by an inherited genetic mutation. Genes are short segments of DNA, our genetic code that give instructions to our cells on how to function. Genes are in every cell in our body, and they're always inherited from both of our parents. If a gene is abnormal, it may not have any impact on your health. Sometimes it may have a harmful effect on the way your body grows and functions, and we call that a mutation. There are some specific genetic mutations that may significantly increase your chance of developing cancer. When cancers occur because of an inherited genetic mutation, they usually occur at a younger age than average. A person with an inherited genetic mutation might be predisposed to more than one kind of cancer, or multiple cancers throughout their life. The genes most commonly linked to hereditary breast cancer are BRCA1 and BRCA2. There are other genes that are not as well known, but they may also be linked to a high risk of breast cancer. These would include PALB2, TP53, CHEK2, and ATM. It's important to realize that if you have an inherited genetic mutation, it may come from either your mother or your father. People who might wish to consider genetic counseling or testing would include a woman diagnosed with breast cancer at a young age, women who have had multiple breast cancers or cancers in both breasts, any man with breast cancer, and women with breast cancer who have other close relatives with breast cancer, ovarian cancer, or pancreatic cancer, or if you have a relative known to have a genetic mutation that increases risk for hereditary cancer. Before you have genetic testing, it is important to speak with a genetic counselor to better understand your level of risk for cancer. A genetic counselor is a health professional with specialized training in medical genetics and counseling. Most genetic counselors have a master's degree in genetic counseling. Some may have degrees in related fields such as nursing or social work. Genetic counselors are trained to advise you about your risk of developing specific types of cancer based on your family history, genetic tests that can give you more information about your risk, emotional, psychological, and social consequences of knowing test results, the privacy of your genetic information. You can get more out of your genetic counseling appointment if you have more information about your family's cancer history. Try to create a list of family members that includes their ages or age at the time of death and the cause of death. Try to identify as many family members as you know that have been diagnosed with cancer, including where the cancer started and their age when the cancer was diagnosed. The counselor will document your family tree and include at least 3 generations. This is called a pedigree. During your appointment with the counselor, you will discuss an estimation of your risk for carrying a genetic mutation, as well as discuss the benefits and limitations of genetic testing. If you choose to undergo testing, the genetic counselor will be able to recommend the appropriate test for you. The testing is done by taking a sample of blood or saliva and analyzing the genetic content. You may expect it will take up to 2 to 4 weeks to get your test results. When the test results are available, your genetic counselor will review them with you and help you to understand them. Some people may have concerns about the cost of testing. Genetic testing can be expensive, especially if it is not covered by insurance. However, many labs that perform testing have programs to cap or limit your out-of-pocket expense. Your healthcare provider can help to find out if your insurance will pay for the test. Some people may fear genetic discrimination or have privacy concerns. If you have worries about this, discuss it further with your doctor or genetic counselor. Discuss your family history of cancer with your doctor, and they will help decide if genetic counseling is appropriate for you. Knowing whether you are at risk for hereditary cancers can help you and your family.